in terms of brain tumours, it can affect anyone. It's only the difference is how they present to you. Most of them present with headaches. These headaches don't get better with simple painkillers, so that's how they investigate further and get a scan and they find something. The second most presentation is seizures. So normally adults shouldn't get a seizure unless there is a cause for it. So if you have a first onset seizure. The third, bit uncommon, is visual disturbance. So they could have blurring of vision or double vision. Most of the time they ignore it because they think it gets better, but if it doesn't, then they investigate it and that's how they find the tumor. Broadly speaking, they're benign and malignant, which is the cancerous type. Benign is the more low-grade type. I see both the groups of patients. The only difference is if it's a low-grade tumor, if I can operate on that and get a complete resection, they're cured for life, which is brilliant. In terms of high-grade, the same thing. I do a complete resection if possible, but sometimes I can't because the way the tumor is. So there are brain tumors which we won't be able to access them because the way they are. Two reasons. One, they could be in areas where the brain has important function, like speech, memory, and power affecting the body and things like that. Or it could be somewhere which is very, very deep inside the brain, like the brainstem, which means that taking the tumor out might actually cause more harm to the patient than benefit. So in those scenarios, what we do is a biopsy and get a diagnosis, and then we treat the brain tumors in a non-surgical way. Brain lab is a type of neuronavigation. The best way to explain this is if you think about having a sat-nav in your car. It's something similar to that. So what we basically do is in theatres with the brain lab machine, you have an infrared camera which is sort of focused on the patient's face. So the scans, the MR scans, is loaded into the machine. So that will be like a Google Maps basically. And then the infrared cameras, we pick up points on the face, which sort of matches the points on the scan, basically. So once we make an opening into the skull to go into the brain, it tells you exactly where the lesion is, where you want to biopsy, where you want to operate. It's one of the latest equipment they have with support from the rep from Brain Lab. And that's all you need actually to do brain surgery. Patients with brain tumors are very anxious because they want to know what's going to happen to them, what is the outcome. So the best thing is for the patient to come and talk to me because it's all the questions what they have in their mind if they don't know what it deals with. So that's why I spend a lot of time with patients actually talking about these brain tumors and explaining to them what it is and what will be the outcome, what we can do treatment-wise, and how best we can deal with this. From the patient's point of view is, if I come to Nuffield Leeds, will I get the best care and which is comparable to the rest of the world internationally? And the answer is yes.